Hello, everyone. I see folks popping on in. Good afternoon. Well, almost afternoon. We'll be starting shortly. We're going to give everyone just a minute to log in and get settled, okay? So hang tight. Aloha, everyone. We'll be starting in just a moment. All right, it's 12 o'clock on the dot. Aloha kako. Welcome, everyone. Thank you for taking time out of your day today to be here with us and for your support of the Alzheimer's Association. We are gathering virtually today to talk about women in Alzheimer's. My name is Ivy Castellanos, and I'm the Director of Programs with the Alzheimer's Association Hawaii chapter. And before we begin, I have a couple of real quick housekeeping items. Please note today's webinar is being recorded, and we'll share the link to the recording after today's session. All of us are going to be on mute today, so if you have a question, feel free to use the Q&A feature at sort of the bottom left of your Zoom screen, and we'll make sure that these questions are addressed at the very end of today's presentation. In celebration of Women's History Month, we were really wanting to elevate the conversation about Alzheimer's disease in women. We as women are disproportionately affected by Alzheimer's. We're more likely to develop it, and we're also more likely to be caregivers. So we are certainly at the epicenter of the Alzheimer's crisis, but we're also very much a part of the solution. There are many notable women in science whose contributions are really paving the way toward a world without Alzheimer's. And we today are honored and excited to hear from a female scientist and educator who's part of this movement to end Alzheimer's. And this is Dr. Courtney Kloske. But before we dive in, I'd first like to introduce another amazing and notable woman, our mission speaker and the current board chair of the Alzheimer's Association Hawaii Leadership Board, Lori McCarney. Lori?
Thank you, Ivy, and thank you for all you do to support so many people that are living with Alzheimer's. Aloha, everyone, and thank you for tuning in today. Since you're here, I'm betting you have a story about Alzheimer's or a form of dementia that you would like to share, and that you're interested in how Alzheimer's affects women, and if there's something that we can do to improve our lot. Me too. With 11 million women living with or caring for somebody with Alzheimer's or another dementia, and with that 11 million people representing 2/3 of Americans living with Alzheimer's, this is indeed a woman's issue. If you were to ask people what disease primarily impacts women, I'm pretty confident the answer would largely be breast cancer. And of course, it is a very serious disease that impacts mostly women and deserves all the energy put behind it. But you might be surprised to learn that women in their 60s are twice as likely to develop Alzheimer's than breast cancer. I watched my dad, Sanford, slowly die from Alzheimer's. He was such an active and adventurous man, always looking for a new adventure in his life. He had lived with lots of excitement over his lifetime, working with Top Gun pilots at Edwards Air Force Base, and then being a key mechanic on the very first Boeing 747, monitoring systems on test flights designed to make sure this important new aircraft would fly safely. As he neared 80, and then gradually over 8 years, I watched Alzheimer's slowly kill him, robbing him of his personality, his memories, and his pride. Last year, I worried that my inability to remember words, speak coherently, and recall events of the day meant I was starting down the same path as my father. I wanted to find out if I was in the early stages of Alzheimer's so I could at least know what my future might hold, so I could prepare for it. Wow, I didn't know it was going to be so hard. I talked to my primary doc here, explaining my concern, who referred me to a local neurologist. I met with this doctor, who after a minor exam didn't see an issue and thought I was too physically healthy to be worried. I restated my concern and pressed for an MRI of my brain, but I was denied. I then returned to my primary care doctor, who told me I should go to the mainland to seek an answer. What? I went back to the neurologist, who got ticked at my persistence, but he did a blood test. He also arranged for a psychological memory test. This test determined that I don't have mild cognitive impairment, which we call MCI. Do I? I'm still not 100% confident, but I'm glad I persisted. You see, there's a cure coming our way, but the therapies only help very early in the disease. We need people to seek a diagnosis like I did. If they have a concern, if they see things that are happening that they just aren't normal. To press our medical community to support us in our fight against this disease. This is where women can have a huge impact. We know how to make things happen, to push for what's needed, to be willing to take the lead and make the effort, to not take no for an answer. The more we ask and demand, the sooner processes and plans will develop to support our needs. If we wait until all the processes for early diagnosis are in place, we could be waiting a long time. When I founded the Beaky Bike Share program, there was concern about putting more than 1,000 bikes on the street without Honolulu having a decent and robust bike lane network. So, should we have waited until more bike lanes were installed? Nope. More people on bikes actually make roads safer for all bicyclists. It's called safety in numbers. At the same time, more people on bikes help the powers that be see that more bike lanes were needed. More bike infrastructure was quickly installed, and the network continues to grow. And with safer places to bike, more people bike, a virtuous cycle, I like to call it. By the way, bicycling is great exercise and a lot of fun, so there's my commercial for you on that. Anyway, I'd like to sincerely thank you for your presence today and for listening to my story. I hope that sometime I can meet with you and that we can share stories. So right now, I'll turn it back to Ivy and our primary speakers.
Mahalo, Lori. And thank you for allowing us to draw inspiration and strength, from your experiences. And thank you for sharing about your dear dad. Mahalo for all you do for the mission. At this time, it's my pleasure to introduce our featured speaker, Dr. Courtney Kloske. Dr. Kloske is Director of Scientific Engagement for the Alzheimer's Association, where she leads efforts to accelerate the organization's scientific agenda by creating and delivering ongoing research education. Dr. Kloske engages with more than 75 association chapters nationwide, informing staff and the public of scientific initiatives and the organization's crucial role in advancing research to improve the lives of all those facing Alzheimer's and other dementia. Dr. Kloske is passionate about engaging early career researchers and works on other initiatives to support the next generation of dementia researchers. Dr. Kloske holds a doctorate in physiology from the University of Kentucky and a bachelor's degree in cellular and molecular biology from Auburn University. During her graduate studies, she also received the competitive National Institute on Aging, or NIA, Research Fellowship. Without further ado, I'm introducing Dr. Courtney Kloske. Mahalo.
Thank you so much, Ivy. And I just want to make sure you're able to see my slides correctly.
Yes, we are.
Great. Hi, everyone. Thank you so much for being here today. I'm really excited to be here to present to you on this important topic and really dive into understanding why are women at a greater risk for developing Alzheimer's. And so how I want to start off is looking at the Alzheimer's Association and really understanding our mission, which you've heard from Ivy and Lori. And our goal is really a world without Alzheimer's and all other dementia. And I hope that that's going to be interwoven throughout the presentation. And I'll be talking a bit more about the resources the association has towards the end. But for our time today, I want to kind of give you a bit of a background and some basics on Alzheimer's disease. I also want to then dive into understanding the impact specifically on women and understanding the role that it has on women, looking at some research advances in Alzheimer's disease, how to get involved in research, and finishing off with those association resources that we have. So I'm going to start by going over some basics of Alzheimer's disease. And by starting here, I want to look at the 2023 Alzheimer's Disease Facts and Figures report. This report you can go online and download yourself, and there will be a 2024 report that's going to be coming out in the next month or so. And it really illustrates the extent and impact of Alzheimer's disease and dementia in the US. And in this report, you can also see state-by-state numbers as well. But when we think about Alzheimer's disease in the US, more than 6 million Americans are currently living with Alzheimer's. Over 11 million Americans are providing unpaid care. And Alzheimer's and other dementia will cost the nation $345 billion in infrastructure. And so this really demonstrates the large impact that Alzheimer's has in the US. And these numbers are expected to increase as the population continues to age, with an expected of 12 million older Americans living with Alzheimer's by 2050, and that cost to rise to nearly $1 trillion. So going into, I want to start off with a bit of an understanding of Alzheimer's versus dementia and kind of understanding the differences between those two, as it's one of the most common questions that I get. And so to kind of distinguish these two, dementia is this umbrella term that's used to describe a range of symptoms, including changes in memory, thinking, and behavior. And so this is going to be that umbrella term. And there are many causes or types of dementia, and Alzheimer's disease being one of those. There are also other causes of dementia, such as vascular, Lewy body, frontotemporal dementia, and sometimes more of a mixed dementia. And in order to undergo a diagnosis of dementia, these symptoms need to be severe enough to interfere with daily living. And so for the purposes of this presentation today, we'll be really focusing on Alzheimer's disease as a cause or type of dementia. So when you start looking as a scientist into the brain and starting to dive into what's actually happening in the brain during Alzheimer's disease, we see these two hallmark brain changes. You might have heard these terms thrown in the media, such as plaques or tangles. And so I want to kind of help you understand what these are. So the plaques are composed of beta amyloid protein, and they form these clumps in the brain. And these are clumps of protein that we call plaques. And this is one of the hallmarks in Alzheimer's disease, and these start forming throughout your brain. And there's another hallmark called tangles, which are composed of the tau protein. And this protein is inside of the nerve cells, or those cells that are helping send signals throughout your brain to help you think and have memories and daily and function. So these nerve cells, the tau protein forms these tangles inside of the nerve cells. And so these two hallmark brain changes are occurring in Alzheimer's disease, and they're both going to be present with the diagnosis of Alzheimer's. But when we start understanding and looking more into the brain, we understand that it's not just amyloid beta and tau, and that's the only thing occurring in the brain. There are also a whole host of other brain changes that are occurring that could be happening that are leading to the symptoms that are seen. So when we look at this brain in the middle of the picture, you can see right here, this is what it would look like in a later stage of disease with severe brain cell death or neurodegeneration. So all of these are contributing together to cause this in the brain. And so when we think of this on the continuum of Alzheimer's disease, we have over here, this is asymptomatic. So this is going to be no symptoms, but there could be biological changes happening in the brain. And research has shown that these biological changes or the starting to develop the amyloid beta plaques or the tau tangles, those could start occurring up to 20 years before symptoms start. And so even though it's an asymptomatic stage, there could be these brain changes beginning to occur in the brain. And as we progress through this continuum, you can see MCI due to Alzheimer's disease. This is mild cognitive impairment, something that Lori mentioned earlier. This is an early stage of memory loss or cognitive ability loss that may develop into dementia. And in the purposes of this slide, we're talking about MCI due to Alzheimer's disease. And then we get into dementia due to Alzheimer's disease. And these are going to be where symptoms start interfering with daily activities more severely. And so early stages are going to be interfering with some daily activity. Moderate is many daily activities, and severe is most or all daily activities in the late stage of disease. And so this really is a continuum, and thinking that these brain changes can be occurring up to 20 years before symptoms occur. And so now that we have an understanding of the basics of Alzheimer's disease, I want to start looking into more of the impact of Alzheimer's disease on women. And Alzheimer's, like both Ivy and Lori said, is one of the greatest threats to women's health. And so I'll be talking about a few statistics here. So almost 2/3 of Americans living with Alzheimer's are women. A key reason for this is age. Age is one of the greatest risk factors for Alzheimer's. And on average, women do live longer than men. But that's not the only reason that is the only reason that's at play here for why there's an increase in numbers of women living with Alzheimer's disease. We also know that more than 10 million women either are living with Alzheimer's disease or are caring for someone who has it. So this is just a very large number of women that are impacted directly by Alzheimer's disease. We also understand that over 1/3 of dementia caregivers are daughters. So again, really impacting women's health. And we'll dive a bit more into caregivers in a minute. And more than 60% of Alzheimer's and dementia caregivers are women. So really showing both on both sides of the disease, the impact that Alzheimer's has on women. And when we start thinking of caregivers and the 60% of caregivers being women, we understand that it's a very stressful role and a stressful task for these individuals to take on to be a caregiver. And almost 50% express providing care is physically stressful. And 62% find it emotionally stressful as well. And providing this care is more commonly linked to depression. And so this is not only impacting women physically, but it's also impacting them mentally. And this is something that we'll talk about with as we get through this presentation of the impacts of stress on the brain. And when we also think about the impact of caregiving in the workplace, there is a large percentage of women that go from full-time work to part-time work when they become a caregiver. Almost 20% of women drop down to part-time work, and 19% quit work as a result of caregiving. Whereas the percentage of men that go from full-time to part-time is only 3%. So again, really impacting women in the workplace. And so just to start thinking about the research and the understanding of maybe why this is happening and why more women are living with Alzheimer's, the mechanisms really aren't super well understood, and more research is definitely needed. But we'll start diving into kind of what is happening here. And so some things that we know are different is brain structure, brain networks and the wiring, genetics in the X chromosome, and that's one thing that we'll highlight later. Metabolism changes, immune system differences, vascular and cardiovascular structures, so the heart and heart health. Hormonal changes through life is a big one that we will highlight as well, and other biological and social factors. So we know that a lot of this is at play, but we don't totally understand why it's at play in Alzheimer's disease. And so we're still trying to understand these questions, and hopefully I'll be able to answer and show a bit of the research that's happening in this space as we move through. So again, we'll be going into some advances in Alzheimer's research. And the areas that I want to talk about are genetic risk factors, hormone and reproductive health, biomarkers, the therapeutic landscape, and modifiable factors in Alzheimer's. So to kick us off, I'm going to start with some genetic risk factors. And for this, we'll kind of break it out into 3 areas with deterministic, risk, and sex chromosome. So first, want to highlight deterministic. And so this type of genetic contributions to Alzheimer's, these genes are very rare. And if an individual has one of these specific gene mutations, they're going to develop Alzheimer's disease in their brain. These genes are very rare. They are typically associated with early onset, and it's very familial. But again, these are incredibly rare when it comes to Alzheimer's disease. But now we're going to look at some of these risk factors, which you might have heard a bit more in the news. And so looking at some genetic risk factors, one that you probably have heard of is ApoE4 or apolipoprotein E4. And this is the largest and most well-known genetic risk factor for Alzheimer's disease. But there are also over 40 variations of other genes that have been identified to either increase or decrease an individual's risk of developing Alzheimer's. And it's important to note that just because it might increase or decrease a risk in one population does not mean it's going to do the same in all populations. And so, again, when we think of ApoE4, this is a risk factor known to increase risk of Alzheimer's disease in some populations. But it does not guarantee the development of Alzheimer's disease. So again, it's just increasing the risk, whereas those deterministic genes are going to lead to a diagnosis of Alzheimer's disease. And so now when we think about sex-linked genes or the X chromosome or the Y chromosome, we can start understanding what are some of these differences when it comes to this. And one thing that we know is that the X chromosome is associated with a buildup of the tau protein and some cognitive changes. And so as women have 2 X chromosomes, then this is going to lead to that potential increase there. But there are also a lot of complicated interactions with the X chromosome that may increase the risk in women and may be protective in men. And so it's really a lot more research is needed in understanding specifically what is happening when it comes to genetics and sex-specific genetic impacts on Alzheimer's disease. The next area I want to focus on is hormones and reproductive health. So female reproductive health across the life course is always changing. And so this is something that is going to be changing throughout life and something that's really important to start understanding what these hormones are doing throughout the life course. This study specifically was looking at over 14,000 women that were in Northern California, and then there was also a smaller study done in the UK. And this was looking at the association with late life risk of dementia. And this specific study found that having 3 or more children decreased the risk. Total months of pregnancy decreased risk. A lower reproductive period also decreased the risk. And a history of miscarriage increased the risk. But exactly what is happening behind this and with the hormones, it's still not totally understood. And one thing that I also want to note here is looking at the impact of hormone replacement therapy on Alzheimer's disease is also very multifaceted and not well understood. Some evidence does suggest that estrogen, one of the main female hormones, has neuroprotective effects or and could help with risk reduction, but there could also be some things at play when it comes to the timeline of the treatment. And so there's a lot of questions that are still being asked when it comes to hormones and understanding the relations between hormones and Alzheimer's disease and when that happens across the life course. So now I want to look at some biomarkers and some biological markers of Alzheimer's disease. Starting off with understanding kind of what a biomarker is. So a biomarker is a biological marker or to measure change. So these are going to be reliable predictors that and indicators of disease and disease progression. So some that you've likely heard of is glucose for insulin resistance and diabetes, or cholesterol for heart disease. Those are biomarkers for those diseases. And we can also start thinking of using biomarkers in Alzheimer's disease to diagnose disease, to help enrich clinical trial enrollment, to help understand the prognosis and determining the course of disease. And they can also be predictive of treatment outcomes and safety assessments. So biomarkers are a huge area of research right now, and it's a very exciting time for sure. And when we look over here at this image, you can see this is one biomarker of Alzheimer's disease looking at brain imaging. And biomarkers really are the new frontier of Alzheimer's detection and diagnosis. And I already mentioned imaging. So on that last slide, you saw a picture of PET imaging, which is able to actually measure the amyloid beta plaques and the tau proteins, which are the first hallmark proteins that I was showing you at the beginning of the presentation. And so we can image and understand what is happening in the brain as a biomarker of Alzheimer's disease. We also have some cool new emerging markers that are still very much in the pipeline, but we're excited to see where they're going to go. Some of these include skin or saliva, and also maybe retinal imaging. And a lot of research is going into understanding some of these more emerging biomarkers. But the ones that I want to really highlight here are the fluid biomarkers. So one that we have we have several FDA approved CSF tests, or cerebral spinal fluid. This is basically the fluid that you get from a spinal tap. You can collect that, and researchers are able to identify and look at the presence of those Alzheimer's markers. So that's a very exciting thing that we're able to do with fluids. And there are also several emerging blood tests that can indicate the presence of Alzheimer's markers years before symptoms emerge. These are still in development stages, but it's a very exciting time, and we're excited to see where this is going. Again, the CSF have FDA-approved treatments or FDA-approved measures. Blood tests are on the horizon. And one thing that I want to highlight with the Alzheimer's Association's work in this space is looking at some work that we've funded and supported with understanding appropriate use recommendations of the using of blood tests in the clinic. And we've Dr. Oscar Hansen, who you can see over here, is one of our funded researchers and has really been instrumental in these recommendations. And you can see a quote from him that these blood biomarkers are very likely to revolutionize the diagnosis of Alzheimer's in the future, but much more research is needed. And so this is an exciting time. We are looking forward to seeing more results coming out about blood biomarkers and how they work in real world populations, not just in small studies. So this is an exciting time, and excited to see more in this space. So now looking into the therapeutic landscape, so those biomarkers are more full spectrum and also looking at some early detection. And when we look into the therapeutic landscape, this slide really shows the progress that we've made in Alzheimer's disease treatments. So these are all the FDA-approved treatments for Alzheimer's disease. You can see the first description of Alzheimer's was back in 1906. And since then, we have had a number of FDA-approved treatments. Starting in 1996 to 2014, these were all treatments that were going to be treating the symptoms of cognition and function. These are going to be in later stages of disease, and they're really just helping with symptoms. They're not changing the progression of disease. Same within 2020, this was treating insomnia. Again, not impacting the disease progression. But in 2021, we actually had a very exciting time in research where we had our first FDA-approved treatment for Alzheimer's disease that slows the disease progression. And so we have Aduhelm and Leqembi. Both of these drugs remove the amyloid beta plaques from the brain. So that amyloid beta protein that I talked about at the beginning. Both of these treatments are going to be targeting that. And this is going to help slow disease progression. And this is going to be in the earliest stages of disease. So when we think about early detection, this is going to be super important. But as you can see, they're both from MCI to mild dementia on this scale, really helping slow disease progression. And we do hope to have a third on this list in the next few months as well. So it's a very exciting time in research, but these two drugs and the one likely on the way are all targeting that amyloid beta protein. But we're not just looking at targeting that. Currently in the Alzheimer's disease drug pipeline, this is last year, there were 141 unique drug therapies in 187 clinical trials. There were a lot of clinical trials happening worldwide, targeting a lot of different targets. And when we look at this figure over here, you can see only 28% of all of those therapies were targeting the amyloid and the tau protein. The rest of them were targeting novel disease processes. And so this has really helped showing that we're not just targeting those hallmark proteins, we're also trying to understand a lot of other areas of disease, including inflammation, how nerve cells are able to talk to each other, and really understanding more and targeting more pathways in the brain. And we'll talk about how to get involved with clinical trials shortly. But one thing that the Alzheimer's Association is doing to help kind of push the field forward with clinical trials is with Part the Cloud. And this funding mechanism and funding program is really helping to diversify the drug pipeline. So really helping with those early stage clinical trials, and not just focusing on amyloid beta and tau, looking at exciting and bigger and different disease targets. This program is helping fuel bold, brave research across the globe, really helping look at new targets to then find new therapies. And so with this program, we've helped fund 65 clinical trials. And so this is an exciting part that the Alzheimer's Association is specifically helping diversify that pipeline. And so now I want to look more at some modifiable factors of Alzheimer's. And this is really looking at focusing on risk reduction. So we know that up to 40% of global dementia cases could be prevented or delayed by targeting modifiable risk factors. And so reducing the risk of dementia is something that you can be doing that is super important to start doing now. And so these can be positive and everyday actions to make a difference in your brain health. And so if you look over here, you can see 10 healthy habits for your brain. And as Lori mentioned earlier, she loves to bike ride. That's a great way to help your brain. Obviously when you wear your helmet, but you're getting moving, you're staying active. That's something great to do. Sleeping well, eating right, keeping your brain active, keeping control of your numbers, whether it's blood pressure, diabetes, smoke-free. So all of these things are super important to help your brain. And combining multiple healthy factors can be the most impactful. And so this is something to think about. I'm not telling you to leave this call today and go do all 10. We're going to start small, but start thinking of ways that you can start implementing these healthy habits into your daily life to one day hit all 10 if you're not already doing them. But just keeping your brain active is going to be one of the biggest ways that you can help yourself reduce the risk of dementia. And a study that I really want to highlight here is the US Pointer study. And this study is a 2-year clinical trial that is helping to evaluate whether lifestyle interventions, such as taking some parts of that 10 healthy habits, may help protect cognitive function in older adults who are at increased risk for cognitive decline. And this study finished recruitment last March with over 2,000 participants and 30% from underrepresented communities. And this is something super exciting that we are very much looking forward to seeing the results from. We can expect some results coming out of the US Pointer study next year. So keep your eye out, and we will be back to give you some updates on Pointer then. Now I want to go into some ways to get involved in research. And this, I want to highlight the Alzheimer's Association's Trial Match platform. So there are currently over 840 clinical studies happening around the world. You can just go to alz.org/trialmatch to see exactly what trials are happening. And there's also, you can see a breakdown of the diseases that it is looking at. But what I want to focus on is opportunities in your community. And so I went on Trial Match myself, and I looked based in Honolulu, Hawaii. You can just type that into the location, and you can see what trials are happening, where they're happening, if you can do them virtually from home. And when I searched this last week, there were 46 opportunities that were virtual, and there were 7 in-person opportunities. So I would highly recommend that if you're interested in getting involved with research, to go onto our Trial Match website and look around and see what opportunities that there are. It would be you can look on the website and see all the information about those studies as well. And for these, I want to highlight that it's not just recruiting individuals with Alzheimer's or MCI. A lot of these studies also need healthy controls. So if you're interested in participating in research, definitely go on to Trial Match and see what's available. So I'm going to finish up with some resources and a little bit more about the Alzheimer's Association. So the Alzheimer's Association leads the way to end Alzheimer's and all other dementia by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. So we do that through a bunch of different avenues, but of course, today I'm going to be focusing on the research pillar. And our research strategy is very dynamic, multifaceted, and we really are helping and trying to help seed new ideas into the research field to help accelerate the science and get it to a place where I can be presenting it to you and highlighting the exciting work happening in the field. And to do this, we are currently funding, we currently have $405 million in active funding, over 1,100 research projects in 56 countries. So that is research that is happening right now across the world, helping us to reach our vision of a world without Alzheimer's and all other dementia. And so to look at it a bit more in your community, in the history, since we've been funding research, we've funded 4 studies on Hawaii, and we're looking forward to continuing to fund and support more for almost $1 million. But the one I want to highlight today is Dr. Park at the University of Hawaii. She was funded in our most recent funding cycle for a funding mechanism that is bringing her expertise from the cancer field into the Alzheimer's disease space. And her work is really looking to understand how blood biomarkers detect Alzheimer's disease among Native Hawaiian, Asian American, and African American participants. And so this is really helping bring what we were already talking about with the blood biomarkers and them needing to be representative of the population. She's helping us understand that today. So we're excited to see what results come out from her work in a few years when her study is finished. And so I want to finish off by going through a few of the resources that we have. We have the Alzheimer's Association website, alz.org. If you add /research, you can look at all of the research that we are doing here at the Alzheimer's Association and the research that we're supporting. You can look more at Dr. Park's study in a few weeks. You can also see more about Pointer and any of the other research that I was talking about that the association is funding. You can find that on our website. Again, if you want to join a clinical trial or learn more about participating or what that looks like, you can go to alz.org/trial match. And we always have our 24/7 helpline available at 800-272-3900. So you can call that anytime that you need any help or support, and they're able to support you. So just a few take-home messages. The Alzheimer's Association really is with you every step of the way, and we're the leader in research, policy, and care. We're the epicenter. Women are the epicenter of Alzheimer's disease, and we really need to continue to understand what is happening in disease and understand more about disease progression. There have been significant advances in biomarkers, treatment, and increasing in the clinical trials pipeline. So it's a very exciting time in research, and we are making so much progress, and we're ready to make even more. And everything we've done puts us in the position today to make the future brighter than ever, and really focusing on that there is hope in research. And I really hope that you've seen that today. So with that, I want to say thank you so much for your time and for your attention. And I've seen a few questions come through the Q&A, so I'm looking forward to answering those shortly. But I will bring Ivy back up for one thing. Thank you.
Thank you so much, Dr. Kloske. I am processing all of the information. I know we have some questions, which we will get to momentarily, but thank you so much for sharing all of that great information. Before we dive into questions, I'd like to take a moment to introduce our last speaker, Mr. Steve Tam. Steve Tam is a volunteer community educator with the Alzheimer's Association. While Steve is not a woman, he is a veteran caregiver who's helped care for 3 family members. And Steve will be sharing a little bit about the association here locally, the Hawaii chapter, how we can be of service and how to connect with us. Steve?
Thanks so much, Ivy. And mahalo to everybody for being here today. I volunteer for the association in memory of my dad, who passed away from Alzheimer's, and also 3 uncles who have also passed away from Alzheimer's. For me, my mom is a good example how this disease can affect women, even if they don't have the disease themselves. Alzheimer's was not kind to my dad. She witnessed 24/7 his cognitive decline and then his physical decline. It broke my heart to witness how this disease took an emotional toll on her. She was so happy when my dad had his lucid days, but they became fewer and fewer. And I felt powerless to console her when she realized and accepted that this disease was slowly taking away his life. That's why I've been associated with Alzheimer's disease for the past 15 or so years. In addition to raising awareness, the association also provides various programs and services. Care consultations are offered, and they're facilitated by trained staff to help families. These consultations may include assessments of needs, help with planning and problem solving, and referrals for additional support. These care consultations can be done locally, or they can be done 24/7 through our helpline as well too. The association also facilitates caregiver support groups in all of the Hawaii counties. I believe there's about 14 support groups every month that is open to the public free of charge. Some are in person and others are virtual as a convenience to family caregivers. Caregiver training and education, such as what you're participating in today, are offered. Additionally, we have and present other educational sessions over Zoom and in person. We also invite you, I wanted to take this opportunity to invite you to an in-person caregiver conference that we're having at the end of this month on March 30th at the Blaisdell Center on Oahu as well. The association also has a 24/7 helpline, 800-272-3900. And through this free service, there are trained professionals who offer confidential support and information to people living with dementia, caregivers, families, and also the public. I also want to invite each of you to get involved. There are ways we can do that. Nick, if you could advance the slide. You can help us find a cure for Alzheimer's by participating in the Walk to End Alzheimer's and also the Longest Day. In 2023, the Walk to End Alzheimer's raised about $1 million in Hawaii to support caregivers and fund research. We do have 4 walks coming up this year at the latter part of the year. On Hawaii Island on September the 21st, Kauai on October 19th, Oahu on November the 2nd, and Maui on November the 16th. And besides the walk, the Longest Day is another key fundraiser for us. It helps raise funds and awareness by turning your hobbies and your passions into a DIY type of fundraiser. The Longest Day fundraisers are occurring now and culminate on the summer solstice, which happens to be on June 20th, the longest day of the year. And Nick, if you could advance the slide, thank you. The association also advocates for persons living with dementia, their caregivers, and their providers. At the Hawaii State Legislature this year, we are advocating for 2 bills. One is what we call our Silver Alert Bill, and that's to create Hawaii's first missing persons program for persons living with dementia or other health conditions that could affect cognitive or mental abilities. And we also have a law enforcement training bill, which is an initiative to ensure that law enforcement personnel have the training needed when responding to emergencies or calls involving a person with dementia. So please come and join us if you are able to at the Hawaii State Capitol on this coming Thursday, March the 7th, at our Advocacy Day to promote these 2 bills. And thank you for your time, and I'll turn it back to Ivy.
Thank you, Steve. Thank you for sharing all that information and for all you do for our mission. At this time, I would like to call back Dr. Kloske, and we will take some questions. There are some questions in the chat. There are also some questions asked via direct message. So if it's okay with you, Dr. Kloske, I'll just go ahead and read what I see here. Elizabeth is asking, both my paternal grandmother and my mom were diagnosed with Alzheimer's. My dad recently went from MCI to Alzheimer's. What is the risk for myself?
That is a great question, and I'm sorry you've been through Alzheimer's with your family. And so when we think about kind of going back to when I was talking about some of those genetic risk factors for Alzheimer's, So sometimes those genetic risk factors can be passed down through the family. So like ApoE4, that could be one. But again, when I'm talking about these risk factors, it does not guarantee the development of Alzheimer's disease or progression in disease stage. And so I think it's really important to if you notice anything, obviously be sure to go and speak with your doctor and bring up any concerns or any memory concerns that you have. I think that's really important. But one thing that I do want to highlight is going back to when I was speaking about healthy habits for your brain. And so since you do have this family risk, starting to think about these healthy habits for your brain as early as possible to potentially then reduce your risk of developing Alzheimer's disease is another great thing to think about. So yeah.
Thank you. And there's another question sort of to piggyback on that. And I think you spoke to it, but Leyland was asking, my mother died of Alzheimer's. Does that put me at a higher risk? So can you, I don't know if you want to maybe elaborate a little bit more on kind of the ApoE4. I know you spoke about some of the things that we can do to mitigate risk, but is there anything else you would like to add? And second part of her question is, what test is there for Alzheimer's? If you could kind of revisit that a little bit.
Yeah, so when it comes to, again, going back to the increase in risk, so if we're thinking about ApoE4, you're gonna have 2 copies of the gene. One of them can be ApoE4, one of them can be one of the other flavors of ApoE. And so it depends on maybe if you have 2 copies of ApoE4, that's going to increase your risk even more. 1 copy is going to increase your risk a fair amount, and no copies or just the more common ApoE3 is not going to impact your risk. And so if you have Alzheimer's disease in your family, there is a chance of an increased risk, but not necessarily due to ApoE or a genetic form. And then looking at that test for Alzheimer's. So if you are seeing memory concerns, if you have these concerns, be sure to speak with your doctor. Your doctor is going to be the first point of contact for any tests that you're going to be able to have done. And so they'll be able to do some memory tests. And so there's a few tests they'll do to understand your cognitive abilities. And then there's also additional screenings that you could go through, which Lori mentioned in the beginning, which are looking at the brain scans. So the PET imaging and the MRI, those can be done to help understand what's actually happening in the brain. There are also FDA-approved CSF tests, and so that's just taking cerebral spinal fluid and understanding what's occurring in the brain from that fluid. And some tests looking at blood is in the process of getting there as well. And so there are tests for Alzheimer's. But be sure to speak with your doctor if you have any memory concerns. They'll be the first point of contact.
Yeah, thank you for answering that. And speaking of tests, Dr. Kloske, can you provide more maybe information or details on the connection between skin and saliva indicators and some of those early changes associated with Alzheimer's?
Yeah, so those skin and saliva are still very much in early stages of understanding, and we're still trying to see how they're going to work and be able to say, okay, here's some skin, let me see what's happening in the brain. And so this is all of these biomarkers and tests are able to, like when we think of a blood test, you're taking the blood and able to see what's happening directly back into your brain. And so understanding how that works and kind of understanding what those numbers mean is something that's still in the works and in process. And so saliva and skin are very much emerging biomarkers. The other one I mentioned was the retina. So the idea of potentially being able to take a picture of the back of your eye and being able to see if there are changes that could be related to Alzheimer's. So these are all very much emerging, but as we keep thinking about biomarkers and new ways to detect Alzheimer's, we can really start to detect Alzheimer's in more individuals, not more individuals, in areas that aren't maybe not able to get the PET scans or the MRIs, and so the other populations are going to be able to get these diagnoses as well. So I see, Ivy, you're talking, but you're on mute. But I see LJ's question of why women with 3 or more children are at a reduced risk for Alzheimer's. And that whole slide, there is still a lot more research that needs to happen as to, is this impacting the hormone levels? Is this like, what is this doing to the brain? And how it's exactly impacting it. And I think that's definitely an area of research that's still ongoing. We've been able to see this correlation in that large study set, as well as a small one in the UK. But understanding exactly why that's happening, it's still ongoing.
Yeah, gotcha. Can you talk about, the vascular and kind of cardiovascular structure differences and, maybe the structure or musculature between men and women and how that might explain risk? And I think it's interesting in, certain families like Steve, where on the male side, there is kind of a generational diagnosis. Is there anything that might explain that, or anything that the research suggests in that regard in those type of situations?
Yeah, so when we I'll go to the vascular health side of it. And so when we think about vascular health, obviously you're going to be thinking about your heart health and keeping your heart healthy. So what all of your doctors are telling you is keep your heart active and healthy and pumping all of the blood. But what's important to know is that every time your heart beats, a lot of that blood is going to be going directly to your brain. And so if your blood can't function, if your heart's not functioning properly, your brain's not able to get as much blood and as oxygen and as many nutrients as it needs. And so it's really important to keep your whole body active to allow your heart to be actually giving your brain the nutrients it needs to function in its best way possible. So yeah, so when we think about vascular dementia and kind of vascular disease in the brain, this is going to be when those blood vessels in your brain aren't working properly. They're not able to get the nutrients to the rest of your brain as well as possible. To your other question about some cardiovascular differences between men and women, I haven't looked into that, but I think that's a great question and something that could be considered in understanding more of that connection.
Yeah, thank you. I know you spoke, Dr. Kloske, about the sort of controversial nature at this point with regard to hormone replacement therapy, but does menopause contribute to a woman's risk of developing Alzheimer's? Are you able to speak to that?
So that adds to the complications when it comes to the hormone replacement therapies and really any of that slide that was talking about the life course of a woman when it comes to hormones. But it's definitely, menopause does play a large role in the overall health of a woman, but also with their brain. So there's going to be lots of changes when it comes to hormones, and those likely are playing direct roles into the brain. women experience brain fog and other brain related changes when it comes to menopause. And so that's an area of research, and we are actually actively funding several grants looking directly at menopause's impact on the brain. And so looking forward to seeing how those studies come out, but it definitely has a role, but the exactly what's happening is unclear.
Gotcha. Yeah, thank you. Thank you for that. Richard shared in the chat that support groups have been helpful for him in the past 3 years of caring for his wife, and that Project Dana is his primary source of information and support. So I think that finding, that network of support is so important for caregivers. So it's wonderful, Richard, that you found sort of your hui. And, there's Project Dana, there's so many community resources that are available. Sometimes it just takes a little bit of sort of research and digging, but they are out there. So it's great that you've been able to connect. We can certainly help get folks connected to those type of resources, whether it's through the association or others that are available in the community. So support groups for a lot of caregivers, as you shared, Richard, is certainly a lifeline. There's an additional question from Jody Lynn. I would imagine these tests are expensive. Do you know if any of these emerging detection tests are covered by private insurances or Medicare, Medicaid? Also, as a follow-up, what about the drugs that slow progression? Are they covered when properly diagnosed? Great question.
That is a great question. I'm actually going to have Dr. Heather Snyder pop on real quick and answer that a bit on that question.
Great, thank you, and thanks for letting me listen in and be here. So great question, and maybe I'll start with the second part of the question first. So the Centers for Medicare and Medicaid Services has approved coverage for the most recently approved medication, Leqembi, which is a monoclonal antibody that Dr. Kloske talked a little bit about, that targets beta amyloid, and when removed, has shown a benefit on slowing cognition and functional decline of the individuals. The Centers for Medicaid and Medicare Services has said that when there is information collected in a registry, either a CMS registry or a CMS approved registry, then those medications are covered. Of course, part of that requires that you also are properly diagnosed, which you mentioned in your question. And so that comes to some of those tests that are actually able to detect the brain changes that we see associated with Alzheimer's. So that's like PET imaging, or looking in the fluid that our brains are bathed in called cerebral spinal fluid. And so far, there are both agents that allow for PET imaging, but there's also tests that are approved by the FDA and are covered by CMS in terms of to measure the levels, the brain changes, and that gives an indicator of what's happening in the brain in the cerebral spinal fluid. As Dr. Kloske talked a lot about, there's also really quite a fast-paced changing environment around blood. And in some centers, we are seeing that some centers are using blood or plasma as part of their diagnostic workup, but that is still pretty far from the mainstream of what we're seeing in the clinic. There's still a lot to learn and a lot to understand about these tests, as well as what they mean and how that information to a patient and what that means. And so that is, at least at this point in time, I'm not aware of those being covered, but that is, again, part of the workup and part of that discussion with your healthcare provider, and does depend somewhat on your insurance. There's not one answer because so many insurances are very different, and it very much depends on the person. CMS, that's the Centers for Medicare and Medicaid Services. So that Medicare and Medicaid, the full name of it is the Centers for Medicare and Medicaid Services, or CMS. Hopefully that answered your question.
Thank you, Heather.
Thanks, Dr. Snyder. Thanks, Dr. Kloske. There, in the news, in the media, there's a lot of articles and talk about blood biomarkers, right? Blood being used to diagnose Alzheimer's. Is there any update or expectation in terms of when this will happen or when this will become a reality?
So yes, this is definitely a big question, and definitely has been in the headlines when we see blood biomarkers, blood tests for Alzheimer's disease, but there's still questions to be understood of, are these blood biomarkers going to work in all populations? Are these going to be, what are the results going to look like in different groups? And so there is still more work that needs to be done. And I think that that's something the FDA is really leaning on and really waiting to see what these blood biomarkers are doing in a representative population. And so they are definitely on the horizon. As Dr. Snyder mentioned, there are some of these tests that are already being used in clinics, but the FDA again has not approved them yet. So this is going to be still in the pipeline. FDA is still wanting some more data about what these markers are actually showing before they give their stamp of approval. So hoping it will be soon, but can't give any definitive timelines.
Sure, thank you. And I don't know that we have any other questions at this point, but maybe could you sort of speak to, what women can do today to, to get us as close as we can to prevent, right, or delay the onset of Alzheimer's and dementia?
Yeah, so I want to really emphasize the 10 healthy habits. And so when we are protecting our heart, you're going to be helping your brain. So when you're eating well, when you're exercising, when you're staying active, those are all really important. That's not the only thing. Staying engaged with your community. So either by volunteering at the Alzheimer's Association or by working with your neighborhood or engaging in some other way, whether that's joining a book club or something of that sort, by staying socially active and socially engaged, that's another great way. Reducing stress. So one of the main points that I mentioned when it comes to women as caregivers is stress is the majority of the caregivers report it's very stressful. And so trying to think of ways to reduce stress in the best ways that you can, that's going to also be helping your brain. Keeping active, protecting your brain from brain injuries, like when you're riding a bike, be sure to wear a helmet. That's a great one. Knowing your numbers. So again, looking at your heart health and looking at your overall brain health, body health is important. So I think those are the main ones. Heart health, staying active, staying socially engaged. Those 10 healthy habits are definitely a great place to start.
Great. Yes, that certainly is a good place for us to start. And in closing, Dr. Kloske, we'd really like to thank you for sharing, all of this knowledge, these updates, and all of this great information. So we thank you for your time and your expertise. Thank you to everyone joining today. Thank you also to Steve Tam and Lori McCarney for sharing on today's call as well. Please join us, everyone, for our next webinar on Thursday, March 14th with Dr. Sandra Von D from EduWorks Corporation. She's going to be sharing a talk on lifelong learning for cognitive and physical health. So sort of a continuation of what Dr. Kloske was sharing. But we'll provide, these details and the link to the recording via email. So thank you again, everyone, and we look forward to seeing you again. Take care.
Thank you.
Aloha.